I know that I may be entering into a controversial area, but veteran services, veteran agencies are one of the easiest programs to mismanage. Programs that provide services for homeless individuals are also easily exploitive. Please, I ask you to do your research when you're looking at these veteran programs. Research them on overhead costs, what their program outcomes are, and if they are actually a legitimate nonprofit. Now, if you are a veteran who is homeless or at imminent risk of homelessness, we encourage you to contact the National Call Center for Homeless Veterans at 877 4AID VET or 877 424 3838 for help. Veterans who are homeless or at risk of homelessness and their family members, friends, and supporters can make the call or chat online with the National Call Center for Homeless Veterans, where trained counselors are ready to talk confidentially 24 hours a day, 7 days a week. And people who can call, family members, friends, and supporters can call on behalf of veterans, VA medical centers, and other VA facilities and staff, federal, state, and local partners, and community agencies and providers who serve veterans who are homeless. Why make the call? It's free and it's confidential. You'll get access to trained VA counselors. It's available 24 hours a day, 7 days a week. You'll get information about VA homeless programs, health care, and other services in your area. And what happens when you make the call, a trained VA staff member asks a few questions to find out what you need. Then you're connected to the nearest VA staff person who can help. Family members and non-VA providers receive information about available homeless programs and services. They can keep their information confidential or leave contact information so staff can follow up. So no veteran should be without a home, without any place to call a home. VA is committed to ending homelessness among veterans, and their focus is threefold: conducting coordinated outreach to proactively seek out veterans in need of assistance, connecting homeless and at-risk veterans with housing solutions, health care, community employment services, and other required supports, collaborating with federal, state, and local agencies, employers, housing providers, faith-based and community nonprofits, and others to expand employment and affordable housing options for veterans exiting homelessness. VA specialized programs for homeless veterans serve hundreds of thousands of homeless and at-risk veterans each year, independently and in collaboration with federal and community partners. VA programs provide veterans with housing solutions, employment opportunities, health care, justice and reentry related services, and more. Now, here are many of the programs that are run by the Veterans Administration. The first one is the U.S. Department of Housing and Urban Development VA Supportive Housing HUD-VASH. Collaborative program between HUD and VA combines HUD housing vouchers with VA supportive services to help veterans who are homeless and their families find and sustain permanent housing. Through public housing authorities, HUD provides rental assistance vouchers for privately owned housing to veterans who are experiencing homelessness. VA case managers may connect these veterans with support services such as health care, mental health treatment, and substance use counseling to help them in their recovery process and with their ability to maintain housing in the community. Among VA homeless continuum of care programs, HUD-VASH enrolls the largest number and largest percentage of veterans who have experienced long-term or repeated homelessness. Next is the Supportive Services for Veteran Families, commonly known as SSVF. For very low-income veterans, SSVF provides case management and supportive services to prevent the imminent loss of a veteran's home or identify a new, more suitable housing situation for the individual and his or her family, or to rapidly rehouse veterans and their families who are homeless and might remain homeless without this assistance. Through referrals and direct outreach, nonprofit agencies and community cooperatives use SSVF funding to quickly house veterans and their families who are homeless and keep others from slipping into homelessness by providing time-limited supportive services that promote housing stability. Case management includes helping secure VA and other benefits such as educational aid and financial planning. SSVF is available in all 50 states, the District of Columbia, Guam, Puerto Rico, and the U.S. Virgin Islands. In Brevard County, Florida, where I was at, Volunteers of America manage the SSVF grant in coordination with the VA Brevard Housing Authority and the Continuum of Care, now known as the Brevard Homeless Coalition. And in a few short years, they were able to reach virtual zero for homeless veterans in the county. Veterans who wanted to be housed were housed. I need to set the record straight, though. Other veteran organizations have claimed the reduction in homeless veterans was due to their efforts, but it was the Volunteers of America that effectively ended veteran homelessness in Brevard County. Homeless providers grant and per diem GDP programs. State, local, and tribal governments and nonprofits receive capital grants and per diem payments to develop and operate transitional housing and or service centers for veterans who are homeless. VA funds over 12,000 beds for eligible veterans. Grantees work closely with an assigned liaison from the local VAMC. The VA GDP liaison monitors the services the grantee offers to veterans and provides direct assistance to them. Grantees also collaborate with community-based organizations to connect veterans with employment, housing, and additional social services to promote housing stability. The maximum stay in this housing is up to 24 months with the goal of moving veterans into permanent housing. Though there are some veteran transitional homes that provide an avenue toward permanent supportive housing, one example I can tell you from Brevard County is Housing for Homeless, there are many others that simply provide the beds for the sake of funding. There needs to be more oversight of veteran transitional housing for two reasons. Veterans remain classified as homeless until they are permanently housed, and funding should not be directed towards maintaining an agency instead of housing the homeless. Next is the Domiciliary Care for Homeless Veterans, DCHV program. This program encompasses residential care for sheltered and unsheltered veterans with multiple challenges, illnesses, or rehabilitative care needs. DCHV provides a structured setting to foster veterans' independence and mutual support, either on VAMC grounds in the community. Participating veterans receive interdisciplinary clinical care that includes medical, psychiatric, vocational, educational, or social services. There are more than 1,700 beds available through 43 sites. Homeless Veteran Community Employment Services, HVCES. Under this program, each VA medical center has received funding to hire new vocational development specialists who are serving as community employment coordinators. To boost employment outcomes for veterans who are homeless who are at risk of becoming homeless, CECs work out of each VAMC to forge partnerships and create relationships with local community organizations and employers who could hire veterans. CECs work with pre-screened veterans who offer a variety of skills and come from all education levels and are backed by VA's entire network of services and providers. Employers can also proactively reach out to their local CEC by visiting the CEC contact information page. Compensated Work Therapy, CWT, is comprised of the Transitional Work and Supported Employment Program, which assists homeless veterans in returning to competitive employment. Veterans in CWT are paid at least the federal or state minimum wage, whichever is the higher. Healthcare for the Homeless Veterans, HCHV. This program offers outreach, case management, and residential treatment services to help veterans transition from living on the street or in institutions to stable housing situations. Operating out of many VAMCs nationwide, clinically trained providers locate veterans who are living in precarious situations and connect them with VA bridge housing, healthcare, and case management services that provide safe, stable living arrangements. Homeless Patient Aligned Care Teams, HPACTS program. Located on the campuses of VA medical centers, community-based outpatient clinics, and community resource and referral centers, HPAC clinics provide a coordinated medical home tailored to the needs of homeless veterans. They integrate clinical care, social services, enhance access, and community coordination. They co-locate medical staff, social workers, mental health and substance use counselors, nurses, and homeless program staff. This team provides veterans with comprehensive, individualized care, including services that lead to permanent housing. Veterans can walk into HPAC clinics without an appointment and receive medical care, case management services, housing placement support, substance use and mental health treatment, community referrals, triage services, benefits, counseling, and even hot showers and clean clothes. HPAC has expanded to 57 VAMCs nationally and is currently actively serving. HPACs are showing promise in improving health and other outcomes among participating veterans compared with non-HPAC patients. The HPAC model is extensively evaluated through multiple research studies and evaluations. Homeless Veteran Dental Program, this other important resource, provides veterans who are homeless with dental treatment through programs such as domiciliary residential rehabilitation treatment, VA grant and per diem, compensated work therapy, transitional residence, health care for homeless veterans, contract beds, and community residential care. VA is working to expand dental care to all eligible veterans. Veterans Justice Outreach, VJO, aims to prevent homelessness by helping justice-involved veterans who have mental health or substance use issues access needed VA clinical services. Healthcare for reentry veterans specialists work with veterans to ease their transition from prison back into community. VJO specialists provide direct outreach, assessment, and case management for veterans in local courts and jails and help them navigate the justice system. Every VAMC has at least one VJO specialist. HCRV specialists meet with incarcerated veterans before they're released and assist them in planning for reintegration in the community by accessing VA and community services as well as housing and employment opportunities. So now I'm going to share some of the programs that I was aware of and worked closely with in Brevard County. First one is the Brevard Veterans Memorial Center, which is a beacon of hope for many veterans, offering a range of services from counseling and support groups to assistance with VA benefits. It's a place where veterans can find help, camaraderie they need. Located in Merritt Island, this center offered counseling, support groups, and assistance with VA benefits. Brevard County Veteran Services is dedicated to helping veterans navigate the complex process of applying for VA benefits. Their assistance can make a significant difference in accessing health care and support veterans are entitled to. For housing, the best way for a homeless veteran to get a housing referral is to talk to their primary care provider at the VA. The VA provides referrals to the Homeless Veteran Outreach Team. The VA provides funding for transitional housing located at various programs in Brevard County, including Volunteers of America. The SSVF program provides temporary and supportive programs for low or non-income veterans and veteran families. These programs aim to promote stability housing through assistance and support services to homeless persons or those at risk of homelessness. They have a Veteran Home Repairs Home Depot mobile unit with support from Home Depot Foundation. VOAFL provides a program for veterans needing home repairs. This program focuses on addressing the repairs that are most urgently required, prioritizing critical health, safety, and adherence to building codes. And then there's the COCO Veterans Village. The COCO GDP program provides transitional housing and supportive services to homeless veterans to stabilize and prepare them for a life of independence. Program fees are based on income. Veterans can remain in the program for up to 6 months. Volunteers of America of Florida is a nonprofit with results-driven programming, which are measured through outcomes. They are single-unit dwellings with roommate, case management, training, education, and employment, basic utilities paid, outside agencies available for rental assistance, laundry, appliances on site, computer lab, Bible study, substance recovery counseling, mental health counseling, and physical health activities. Additionally, must be a veteran with general, other, or honorable discharge, must have had 1 day of active duty post-training, accepts male, female, and limited families, must be homeless or imminent risk of becoming homeless, follow program rules and guidelines, and if applicable, pay the program fee monthly. Also they're connected with the U.S. Department of Veteran Affairs. And they are 42-bedroom units. Housing for Homeless offers a variety of housing and supportive services for veterans experiencing homelessness, bridge housing, low demand, service-intensive case management, and permanent housing. Referrals are received through Veterans Affairs, VA, and other agencies. Low demand is for chronically homeless veterans and veterans who have been unsuccessful in traditional treatment settings. Low demand does not require sobriety or compliance with mental health treatment as a condition of admission or continued stay, and typically assists the veteran for up to 2 years. Overall demands are kept to a minimum. However, services are available as needed, and 24/7 security is provided in a 10-unit apartment building set up in their Victory Village wooded campus in Titusville area. The goal is to assist the veterans' integration into society. Supportive services in low demand may include job training, job placement, applying for disability benefits, budgeting and other educational classes, counseling and social activities, transportation, and other relevant services designed for increasing self-sufficiency and independence. They are service intensive. Intensive services are for veterans experiencing homelessness who have a lower acuity. They have less critical social or medical issues than those in low demand, but are still offered the same wide range of supportive services. For case management, veterans who have completed supportive services with Housing for Homeless or other VA programs and who are now in their own homes but require some support for up to 6 months can receive ongoing case management services. This helps ensure they have a sustainable lifestyle, enabling them to remain in their homes. And the permanent housing or permanent supportive housing has 10 housing units for retired and permanently disabled veterans, also set in the Victory Village wooded campus in Titusville. The tranquil setting allows for disabled veterans to enjoy their daily activities without concern of external stress that may disrupt their ability to remain in a stable environment. The level of support is less intense, and the case management and individual plans are designed to meet the needs of each veteran as his or her needs change. Local homeless shelters and support services are crucial in providing immediate relief and support to those in need. They offer essentials such as meals, shelter, and various forms of assistance to help individuals get back on their feet. And I'll mention some of those other services. One is the Vietnam and All Veterans of Brevard Transitional Facility. The Veterans Transitional Facility is a temporary shelter for homeless veterans with their immediate families. The purpose of this facility is to provide for the immediate needs of homeless veterans while permitting them to search for work, and once employed, to save enough money to acquire living quarters and transportation. The facility consists of 10 apartments housed in 2 buildings which can accommodate up to 19 residents. In addition to the living areas, there's a day room, a commercial kitchen for preparing meals, and a storeroom for storing food and other supplies. Now, from my own experience, this organization does not cooperate with the Continuum of Care, otherwise known now as Brevard Homeless Coalition, or the government assistance programs, and they also incorrectly state the number of homeless veterans in Brevard County at 30% when the actual total is only 119 total homeless veterans in Brevard County. NVHS, the National Veteran Homeless Support Mission, is to end veteran homelessness in Brevard County by offering extensive resources and dedicated support. Recognizing the sacrifices made by veterans, they're committed to providing the necessary assistance to get them back on their feet. Whether you seek support, they stand ready to guide you every step of the way. So primarily they have 3 programs. The first is outreach. Their mission is twofold: to seek out unsheltered veterans who are living on the streets or in vulnerable circumstances, and to intervene before financial challenges lead to homelessness. Their dedicated team of outreach staff and volunteers actively navigate the community, ensuring that those in need receive the vital support and resources necessary for their journey to stability and dignity. Second program is post-traumatic stress awareness. The NVHS PTSA program is a beacon of hope for these individuals, providing essential support and resources and fostering a sense of belonging. The PTSA program is a comprehensive initiative designed to support individuals who have PTSD while educating the broader community. Its approach is based on 3 foundational pillars: awareness, educating the community about PTSD and dispelling myths; action, offering access to essential resources like therapy and support groups; and anonymity, providing a safe and discreet environment for those seeking help. This structure ensures that people living with PTSD feel supported while maintaining their privacy. The program's goal is to break down the stigma surrounding PTSD and foster a compassionate community where sufferers are empowered to seek help. And then finally, transitional housing. At the heart of their program are 17 beds spread across 4 properties in Brevard County. There aren't just places to sleep, but launching pads for new beginnings. Here, veterans and their dependents find the stability they need to focus on their future without worrying about where they'll lay their heads at night. This temporary housing for homeless veterans creates an environment conducive to healing and growth. Now, personally, I've known NVHS for quite a few years, and a few other comments that I need to make about them, for my own integrity's sake. And first of all, it is a family-run organization, and it doesn't participate in the Housing First model and fills its transitional beds to maintain its funding. The search and rescue outreach program is no longer needed, as there are only 119 homeless veterans who choose to stay homeless in Brevard County. The post-traumatic stress awareness program is a much-needed service, and additional programs to provide case management services for housed veterans, not the homeless, would be a best way for them to go forward. Thank you.